Low blood pressure, hypotension. Low blood pressure might seem desirable, and for some people, it causes no problems. However, for many people, abnormally hypotension can cause dizziness and fainting. In severe cases, hypotension can be life-threatening. A blood pressure reading lower than 90 mm of mercury, Mhg, for the top number, systolic, or 60 mm Hg for the bottom number, diastolic, is generally considered hypotension. The causes of hypotension can range from dehydration to serious medical disorders. It's important to find out what's causing your hypotension so that it can be treated. Causes of low blood pressure. Blood pressure is a measurement of the pressure in your arteries during the active and resting phases of each heartbeat. Systolic pressure. The top number in a blood pressure reading is the amount of pressure your heart produces when pumping blood through your arteries to the rest of your body. Diastolic pressure. The bottom number in a blood pressure reading refers to the amount of pressure in your arteries when your heart is at rest between beats. In particular, current guidelines identify normal blood pressure as lower than 120/80ths of a millimeter Hg. Also, blood pressure varies throughout the day, depending on body position, breathing rhythm, medications you take, physical condition, stress level, what you eat and drink, time of day. Meanwhile, blood pressure is usually lowest at night and rises sharply on waking. Blood pressure, how low can you go? What's considered hypotension for you may be normal for someone else. However, most doctors consider blood pressure too low only if it causes symptoms. Some experts define hypotension as readings lower than 90 mm Hg systolic or 60 mm Hg diastolic. In particular, if either number is below that, your pressure is lower than normal. A sudden fall in blood pressure can be dangerous. A change of just 20 mm Hg, a drop from 110 systolic to 90 mm Hg systolic, for example. They can cause dizziness and fainting when the brain fails to receive enough blood. And big drops, such as those caused by uncontrolled bleeding, severe infections or allergic reactions, can be life-threatening. Conditions that can cause hypotension. Medical conditions that can cause hypotension include blood loss. Losing a lot of blood, such as from a major injury or internal bleeding, reduces the amount of blood in your body, leading to a severe drop in blood pressure. Dehydration. When your body loses more water than it takes in, it can cause weakness, dizziness and fatigue. Specifically, fever, vomiting, severe diarrhea, overuse of diuretics, and strenuous exercise can lead to dehydration. Endocrine problems. Thyroid conditions such as parathyroid disease, adrenal insufficiency, Addison's disease, low blood sugar, hypoglycemia, and, in some cases, diabetes. They can trigger hypotension. Pregnancy. Because the circulatory system expands rapidly during pregnancy, blood pressure is likely to drop. This is normal, and blood pressure usually returns to your pre-pregnancy level after you've given birth. Heart problems. Some heart conditions that can lead to hypotension include extremely low heart rate, bradycardia, heart valve problems, such as heart attack and heart failure, lack of nutrients in your diet. A lack of the vitamin B12, folate and iron can keep your body from producing enough red blood cells, anemia, causing hypotension. Severe infection, septicemia. When an infection in the body enters the bloodstream, it can lead to a life-threatening drop in blood pressure called septic shock. Severe allergic reaction, anaphylaxis. Common triggers of this severe and potentially life-threatening reaction include foods, certain medications, insect venoms and latex. Moreover, anaphylaxis can cause breathing problems, hives, itching, a swollen throat and a dangerous drop in blood pressure. Symptoms of low blood pressure. For some people, hypotension signals an underlying problem, especially when it drops suddenly or is accompanied by signs and symptoms such as blurred or fading vision, dizziness or lightheadedness, fainting, nausea, fatigue. Lack of concentration. Shock, the most dangerous symptom. Extreme hypotension can result in this life-threatening condition. Signs and symptoms include cold, clammy, pale skin, rapid, shallow breathing, weak and rapid pulse, confusion, especially in older people. When to see a doctor. When you have signs or symptoms of shock, seek emergency medical help. In particular, if you have consistently hypotension readings but feel fine, your doctor will likely just monitor you during routine exams. Even occasional dizziness or lightheadedness may be a relatively minor problem, the result of mild dehydration from too much time in the sun or a hot tub, for example. Still, it's important to see your doctor if you have signs or symptoms of hypotension, because they can point to more serious problems. It can be helpful to keep a record of your symptoms, when they occur and what you're doing at the time. Medications that can cause low blood pressure. Some medications can cause hypotension, including alpha blockers, such as prazosin, Minipress; beta blockers, such as atenolol, Tenormin, and propranolol, Inderal, Inopran XL, others. Certain types of antidepressants, tricyclic antidepressants, including doxepin, Silenor, and imipramine, Tofranol. Drugs for Parkinson's disease, such as pramipexole, Murapex, or those containing levodopa. Drugs for erectile dysfunction, including sildenafil, Revatio, Viagra, or tadalafil, Adcirca, Aleak, Cialis. Particularly when taken with the heart medication nitroglycerin, Nitrostat, others. Water pills, diuretics, such as furosemide, Lasix, and hydrochlorothiazide, Microzide, others. Complications of low blood pressure. Even moderate forms of low blood pressure hypotension can cause dizziness, weakness, fainting, and a risk of injury from falls. Also, severely hypotension can deprive your body of enough oxygen to carry out its functions, leading to damage to your heart and brain. Risk factors. Hypotension can occur in anyone, though certain types of hypotension are more common depending on your age or other factors. Age. In particular, drops in blood pressure on standing or after eating occur primarily in adults older than 65. Also, neurally mediated hypotension primarily affects children and younger adults. Certain diseases. Specifically, Parkinson's disease, diabetes, and some heart conditions put you at a greater risk of developing hypotension. Medications. People who take certain medications, for example, hypertension medications, such as alpha blockers, have a greater risk of hypotension. In particular, the simple exercises that increase hypotension. Right now, right where you're sitting, free solution. Link in the description. Thanks for watching. Good health. Do not forget like, share, and comment with us.